Welcome all. I'm Laura Gunter. For anyone that doesn't know me, I'm the president of the North Carolina Life Sciences Organization, or NC Life Sci. We are the member supported trade association for the industry here in North Carolina. And it's one of the areas that we think we can be very helpful is in helping find good health insurance for smaller companies. We tried to do this several years ago and were thwarted by the North Carolina Department of Insurance. But now, through some legislation allowing association health plans, we are able to put this program together and offer everyone an opportunity to participate. So, what the association health plan does, and I'm going to turn it over to Marsh McLennan, our broker and partner in this endeavor, in just a minute to go through the basics. But really, for us as the trade association, what we're thinking is this allows members to band together to become part of a larger group and to take advantage of the fact that many folks in the life sciences industry are, young, healthy, well-informed, and sort of make a good group of, lives that can be part of a single kind of insurance group. And so we're excited to offer this, but we need to have good participation at the beginning so that Blue Cross Blue Shield that we'll be working with really can assess the sort of value to them, obviously, as well as to our members. So that's what we're here to talk about today and to go over some of the qualifications and requirements. So I'm going to go ahead and turn it over to Sam Eller with Marsh, and he and his team will kind of take it from here, and then we'll be able to come back around and have some questions, or if you would like to ask as we're going through them, kind of feel free to just use the raise your hand function to alert us that you have a question. All right, with that, Sam, take it over. Thank you.
Okay, sounds good. Thanks, Laura. Alexandra, if you don't mind going to the next slide. So nice to meet everybody. My name's Sam Eller. I'm a consultant here with Marsh McLennan. Been with the organization about 3 years. And the broad team you see here is supporting this program both from a trust consulting perspective and a brokerage perspective. And so I have Shay Edwards on the phone with me, and I'll let her introduce herself in a second here. But William Solomon has been involved with this since inception. He is another one of the consultants involved here. Mark Lamberth is a member of our team as well. He is really a trust and MEWA consultant, really an expert in this space, and has worked with these programs for quite a while at this point. Lindsay Larkin, who is not on this call, is the senior client manager on this program. And so I'll let Shay introduce herself, and then I'll get into the meat of things.
Sure. Good afternoon, everybody. Thanks for having us. My name is Shay Edwards. I'm the client support specialist. We got to update my slide for the association health plan. I work a lot behind the scenes, so I do a lot of the emailing at the inbox and the portal setup level. So if you're ever reaching out, it's typically going to be me or Sam. Glad to see you all and happy to answer all your questions.
Thank you. Alexander, if you don't mind going to the next slide. And so I wanted to briefly describe what MMA's role is and then what an association health plan is. And so MMA's role is to act as the consulting and distributing partner for the NC Life Science Association health plan, right? We are also the liaison to the carrier partners and then the general broker to participating employer groups. An association health plan is an exclusive insurance product on the marketplace, as Laura mentioned, that's only available to eligible organizations of a specific industry. And so the NC Life Science AHP is a bona fide association health plan, which means that the North Carolina Life Science Association will establish a trust, appoint trustees, and will operate a large group fully insured Blue Cross Blue Shield program in the state of North Carolina. The idea behind an association health plan is to bring leverage and scale to group insurance products, right? AHPs are preferred risk pools, which means that organizations who have either younger or healthier employee populations typically benefit the most from the underwriting techniques at play. By pooling organizations with good risk, the AHP can reward these organizations year over year with lower premiums and reduced renewal prices. And so by being in a large group fully insured program, employers have access to richer benefit options that are not typically available in the small group market. This program also gives organizations access to a robust benefits administration system. That system, Simon, which Shay will hit on shortly, handles the enrollment, the eligibility, reporting, billing, and then COBRA administration. So this is really a turnkey product in the marketplace. And while we feel it's important for each life science organization to, one, evaluate this program, but two, realize that it may not be a fit immediately, right? Your risk profile is going to change over time. And so for that reason, it may be a better fit in the future. The program has an annual renewal date of January 1st, which means that organizations will be eligible to join this program for the first time in January of 2027, but then we'll be able to join at any other time throughout the year. It's important to note that there is a common renewal date with this program. That is January 1st. And so that's a high-level overview of what an association health plan is, what MMA's role is. And with that, I'll turn it over to Shay to hit the tech platform. So Alexandra, if you don't mind going to that next slide.
Yes, as Sam mentioned, we use Vimly or Simon. We kind of use them interchangeably as our preferred vendor partner. And the way I like to explain them is like Meta owns Facebook. It's kind of like Vimly owns the platform, Simon. So Vimly, as our technology vendor, helps a lot with the broker support, a lot of the compliance related stuff, as well as the carrier file feed integration. So the information getting from our platform to Blue Cross to make sure everything runs smoothly. And then Simon, and the actual platform itself, is where you would go to do your open enrollments, any sort of maintenance for your employees. It's a very user-friendly website that is also compatible with your phone. So I know a lot of people like to do things on their phone, but they offer a lot of reporting options. So a lot of different census types, a lot of different payroll breakouts, as well as lots of resources for how to navigate the platform itself, as well as all the payments go through the Simon portal. Any other specific questions on the platform? Or any other comments, Sam?
No, no other comments for me. Alexander, you can go to the next slide. Our goal here, people, is to be brief, be bright, and be gone. And we want to leave room for a Q&A. So I did want to hit the participation requirements, the contribution requirements, and then what the underwriting process looks like. So to participate and purchase this insurance product, you do need to be a member of the life sciences organization. You do not need to be a member to receive a quote. You need a minimum of 2 employees to participate in this program. A married couple counts as one. And the reason for that is this is a group health product, right? And so Blue Cross and the ERISA guidelines require a grouping of employees to be enrolled in the insurance product. And a married couple, unfortunately, counts as one. For the employer contribution requirements, 50% of the employee-only tier must be covered by the employer, and you'll find that that's standard across the group health insurance market. If you are offering more than one plan, the 50% employee-only contribution requirement is on the non-HPN lowest plan. And we don't have a slide in this deck about what an HPN is, but it's the high performance network. It's a restricted network in the state of North Carolina via Blue Cross. So just another option for employees. For the dental and vision, 25% of that employee-only tier must be covered by the employer. And then on the underwriting and quoting process, you have a few different buckets of risk pools in the North Carolina market, right? The first, and what you all may be most familiar with, is the ACA market, right? That 2 to 50 space. There is no medical underwriting with that product. And so the life science program is a little bit different in that regard, right? There are multiple factors that Blue Cross is considering here. First is age and gender and location, and then industry. And beyond that, they are looking at the overall health status of your employee population, right? So if you have employees with high cost conditions, employees that are utilizing high cost prescriptions, Blue Cross is factoring that into the underwriting process and assigning you a risk band because of that. Your risk band is what determines your medical premiums. And so if you are on the upper echelon of the risk spectrum, your medical premiums will be more expensive. If you are on the lower end of that risk spectrum, your medical premiums will be cheaper. And so not to get too into the weeds here, but I did just want to high level explain how the underwriting process works here because it is a bit unique. Yeah. Shay, any color to add there?
One clarifier that a question I got recently was about the two minimum employees, the married couple. That only factors in if there's only two people. So if, say, you have 10 employees, but one subsection of them are married, that doesn't matter. It's really only, we've had some smaller groups where it's sometimes just a husband and wife or situations like that. So it's okay if you have married couples that also have employee only on this. That's just for like the minimum number. But that's really all to add there.
Good comment.
I have a question.
Sure.
Just to clarify, the premiums for individuals will be different based on their, no.
So the premiums for each organization will be different based on their assigned risk band.
Okay.
And then the plans within the proposal will have different premiums. The premiums are built on a composite basis, which I can go into detail on, but the easiest way to describe it is they're not age banded, right? So a 25-year-old and a 65-year-old have the same exact monthly premium.
And it's
Okay.
based on like enrollment tier essentially. So like if an employee wanted an employee only plan, that price is the same for each employee only plan. Or if they wanted employee spouse, that price is set at that rate.
Correct.
Okay.
Yes, Maggie, you have a question?
First of all, thank you so much for hosting this webinar. My question is like, can employer cover more than 50?
Yes. Yep, you can.
Absolutely.
So
Is minimum,
that
right?
Yeah, that 50% requirement is just standard across the industry. Now, there are different rules and regulations regarding ACA and safe harbor requirements. When you have a certain number of employees, that number is 50, you're beholden to contribute in a way that is richer than when you have less than that 50 full-time employee count, but you can contribute however much you want above that 50% requirement. It can be down to the percentage point. Yep.
Thank you.
You're welcome. We can go to the next slide. So I'll let Shay touch this, but I just want to add a comment. We are in the very important process of this creation of the program where we're collecting census data. And so your participation is extremely important, right? Even if you do not see yourself participating in this program and don't see it ever being a fit for you, you providing your employee census to the broad sample that we're collecting helps Blue Cross put together a base of premiums that are going to be richer and more diverse than what it would be if we had a smaller base. And so we would highly encourage you to submit your census. You are helping not only yourself, but the other life science organizations that are interested in this program. So just want to briefly add that comment.
And to add to that as well, there's nothing to submitting a census or receiving a proposal. And that's why Sam often will reference this as a financial exercise where if it's like yearly, we just submit a census just to see if it'd be worth changing over, because as you have turnover and as employees change, so does that risk pool, and so can those rates. So that can mean for the better or for the worse, but there is no strings attached on getting a proposal, so there's no harm in sending it. But I'll walk us through the process of how to get a proposal. So essentially, just shoot us an email at the NC Life Science inbox here and just express interest. That can even just be questions. We will send you the census template. Should be pretty self-explanatory, but what we want you to do is to have all eligible employees on the census. So even if somebody, is eligible, but they have Medicare, just indicate that on the census, as well as all dependents who would be covered. So if you currently offer benefits and your employees have employee child, make sure you also include that child on the census, because that is factored into your risk pool. Once you've completed the census, you can send that back to that same inbox, probably on the same email chain. From there, we send it to Blue Cross, and that's who does the risk assessment. We don't personally do that. And we will receive your tier back from them. Once we get that back, we'll send you a proposal that outlines your medical rates for all the plan options. So not just one or two, you'll be able to see the full range, as well as all other benefits included, and those are all shelf rated. So those numbers, dental, vision, those numbers don't change except for year to year during renewal. Those are the only time those numbers could change. But excuse me, we try to give you a lot of leeway in the renewal process to keep you informed on if those rates will be changing.
So two quick comments. Sorry, Shay, to cut you off.
All good.
First, if you do not have a group health plan today with your organization, you do not need to include dependent information. We just need the employees. Second, you will not receive a proposal for this program until mid to late third quarter of this year. We are aiming for September, hopefully late September at the latest. And that is because we are still collecting census information, sending that to Blue Cross, having them underwrite it, developing the plans, and then developing the proposals. And so that takes some time. So just want to add that brief comment.
Yep, absolutely.
Very quickly, we do have a question from Leanne. Oh, looks like Laura just answered it, but it was confirming if which NC Lifetime members are able to participate.
That's correct. Yep. Laura answered that perfectly.
Yes, and for anybody that's not looking at the chat, it's based on your NAICS code. Sorry, I had to look at that and make sure I spelled it right. So there's like a certain number of codes that are accepted for the life sciences group, and as long as you're within that, you are welcome to join or participate.
Yep.
Next step on the proposal process, I know it's kind of longer down the road to January, but if you receive a proposal and you're like, yes, we 100% want to jump on, or if you have any other follow-up questions, we'll gladly schedule a meeting, sit down, talk through the logistics. But once we get the confirmation, we will confirm with the NC Life Science group that you are in fact a member. That is an important part. You do not have to be a member to get the proposal, but you do need to be a member to join. So there will be, if you aren't already, there could be an added extra fee to that. And then once we get that confirmed, then we start the paperwork process, and that's probably where you will start seeing my name a lot more often. I'm usually on the paperwork side of things, but you'll have a couple forms to fill out. You'll confirm your contribution rate. We're talking about that 50% contribution. We'll send over a contribution sheet that outlines everything you need. And then once that's done, we'll set up the Simon portal, which is just the enrollment platform for your employees. And then you'll send out the open enrollment, and then that's that.
Yes, question from Kim.
Yes, I have a couple of questions. Right now, our renewal period begins on October 1st. What
Yep.
would happen in that case if we wanted to? Would we have to wait until the following October of 27 to join, or?
No, so we would want to have that conversation with you and evaluate the competitiveness of this program compared to your current program, right? If you were to say, for example, renew October 1st and then terminate for January 1st to join this program, you would be subjecting your employees to a short plan year. And so we just would want to have that conversation, talk through what those implications are. You may have a relatively healthy member base, and that short of a plan year may not be an issue for them. Right now, you may have employees that have surgeries or procedures scheduled in that 2 month period. And so you just want to be conscious of that. But that's a
You have to do,
conversation that we can
you have to
have.
do more with if they, how much deductible they've blown through.
Exactly.
Yeah.
All of the accumulators would reset back to zero. And so if you have employees that have hit that because they've had an accident, went to the ER, et cetera, that may be a problem for them, right? But we can have that conversation.
And
Also,
it'll, oh, go
I'm
ahead.
sorry.
No, you go ahead.
Another question I was trying to email Sam, I had the wrong email address. Is there a way we can blind the names on the census?
There is not. So Blue Cross requires the names because they are pooling information from a large data lake. And in order to do that, they need accurate employee information to assess your risk as a population. And an
Okay.
example that's kind of related here is say you have 10 employees, you have one that's not interested in this program at all. Oh, I don't care. I don't want health insurance. Okay, well, as me, the employer, I'm going to leave them off the census. Okay, so you submit for a proposal, you get a risk tier that is not indicative of the full risk of your organization. And because of that, your premiums may be cheaper. Well, that employee may see those prices and decide, hey, I'm interested. I actually do want to buy this because it's cheap. Well, that is going to come back and bite you in the butt at renewal, right? Because they may be a high cost claimant. They may have a high cost prescription, and that risk is going to be added to your profile. And at renewal, your increase will be indicative of that, right? So you just want to make sure that you're accurately representing your population so that when you get your premiums back, you know exactly what you're dealing with. Does that make sense?
Yes,
And
yes, thank you.
to add what Laura had just put in the chat, to be clear, we get all that data, we send it to Blue Cross. There is nobody in your program that actually receives that data, so it goes straight to Blue Cross, and we pretty much scrub it once we're done.
Yeah.
So
We don't know who your high cost claimants are. We don't know what
yeah.
prescriptions they're taking.
And they
None of
really
that. We
don't
just
tell
go-
us much. They don't tell us much about the risk tiering because that again is all based on PHI. They just give us a number, and that's very hard for us to get even further in-depth data because they keep it on lockdown. So
Yep.
Okay, good. Good now, thanks.
absolutely, all good questions.
Yes, Maggie.
I have another question. So is this Blue Cross Blue Shield is only applied for North Carolina residents?
No.
We
This
have another site in California. Will this plan cover the employee in California also?
So this program is built on the Blue Options Network, which is Blue Cross's national network, which means there is coverage in all 50 states. Now, we would want to run what's called a geo access report, just to be sure that you don't have employees in maybe rural areas of other states that might not be able to access care. So we would confirm that for you, right? Just to make sure that employee does have the ability to access care. But this program is built on the Blue Options Network. If you have out-of-state employees, they can participate in the program.
Oh yeah, they are just in the California and Los Angeles. It's not
Okay, great. Yeah, so I'd
And
imagine there's
another
coverage.
question, like related to like, do they have to join the NC Bioscientist Society? Because this, I know when we join this society, like we count employee numbers, so we need to put all our both sides employee to this.
Yeah, I can answer that. So we in North Carolina, we have members join based on your North Carolina FTE, full-time employee headcount. For something like this, that would remain consistent, and you could just add the other people. It would not cause that plan amount or the membership dues to go up.
Okay,
Thank you, Laura.
you. Mhm.
And so just general comment here. I know this is a lot. It's probably very confusing if you are not used to group health coverage. Please come to us with any question you have. Even if this program doesn't make sense and you do not work with Marsh McLennan ever, we're happy to be a resource for you because it's difficult to navigate insurance if you're not familiar with it. So just let us know. My email is in the chat. Any little question you have, we're happy to help. Yes, ma'am.
Okay, I just thought of another question. Because we're a small
Right.
group, as we age out, the 65-year-olds are forced out onto Medicare.
Mhm.
If this becomes,
You have cut out, Kim. Unless Shay, did you hear her question?
did I cut out? Oh,
I
I'm
think you
sorry.
lost it. We lost you.
Back.
If we are able to join this plan, does that then make it a large group employer and that we are able to get back onto the group plan and not have to be on Medicare?
It's my understanding that Medicare pays primary, the group plan pays secondary. Um, Whether you can do away with Medicare entirely if you have the access to a group health plan, I am not sure. I believe everyone who's 65 and older is automatically enrolled into Part B. Um, but I am not a Medicare expert. So
Okay.
I'll do some research into that.
Okay. Thank you.
Yep.
Any other questions?
What else?
Yeah. Maggie.
Yeah,
Yes.
it's me again.
Hello.
I'm an HR journalist of TCR Care, so I'm handling all the benefit renewal thing. So actually, I have the same question as Kim, if I remember correctly. So our renewal starts July 1st each year.
Mhm.
So which means we need to start continue to use what we have right now till December 31st, and then we move on to Blue Cross. Like, if we would like to move forward,
If it
right?
makes
So
sense.
January
Yeah.
1st, right?
Yeah.
Okay. Just I just want
So
to
you,
confirm with that.
yeah. And so Maggie, I'd want to have a conversation with you about that, right? Because that's an even longer plan year than an
Mhm.
October renewal. And yeah, you just want to be conscious about making that switch, if especially already giving employees 6 months to build up those deductibles. But the program may be so competitive that you kind of have to. Um, yeah, that's a conversation we can have.
So I think it's no harm to get get a quote for that.
Yeah.
Yeah.
Yeah, and
No,
one
that's
question, like, for currently we offer three different health insurance plan for employees. So when I ask for quote, can I ask like a multiple plan
You
quote?
will
Not
get
only,
multiple. So,
yeah,
yep,
not
good
only
question.
one, right?
Every organization that submits for a proposal is going to be presented with the entire offering through the program, which is likely going to be 24 plan designs. That is subject to change. And so we can review each of the plan designs with you and help you decide, hey, what's comparable, what makes sense. And you can offer up to 4 plans to your employees through this program.
Okay, okay.
Yep.
And another question, I know, kind of related to health insurance plan too. Will an FSA plan like integrated with this brochure broker?
Yep. We have a preferred partner that will help you with HSA, FSA, DCA, HRA, LSA, you name it.
Okay.
They-
Good to know. Because our current like insurance, they have like FSA, and so I don't want once we if we switch to a new benefit, I don't want my employee lose that benefit.
Yeah. So the nice thing about HSAs and FSAs is you can use really any vendor partner as long as you have a plan that's qualified for those
Yes.
spending accounts. So if you were working with Optum, for example, you could retain Optum through this program. You would be contracting with them directly. But yeah, again, another conversation that we can get
Yes.
into.
Okay. Good. Thank you so much.
You're welcome. Yep.
I do want to just to confirm that an option will be a high deductible health plan.
Yes, ma'am.
Okay,
Yep. There will be multiple. Mhm.
perfect.
And so to give an idea of how we're structuring the benefits in this program, Marsh McLennan is a large national organization. And so because of that, we have clients across multiple industries and therefore have access to benchmarking data. And so what we have undertaken as a team is benchmarking that industry to find out, hey, what is competitive in the life science and biotech industry, and we are going to design plans based on that, so that when a organization with group health coverage submits for a proposal, they are being presented with benefits that are comparable to a degree. Yes, so PPOs, all copay plans, high deductible health plans, all are going to be included.
Yeah. And
What
as they,
else?
and I think, just to kind of reiterate, there is no commitment as participating in the census. And I think the better numbers and larger number of companies and lives that we present to Blue Cross, I think should benefit the entire ecosystem. So, we are hopeful that a lot of folks will participate, get the information back and see what really works. So, we feel like just based on sort of doing this before, it looked like it was pretty, robust. In fact, our plan was set to turn March 1, and the pricing, we got a much higher increase with our current plan than we were going to have had with this AHP. So, and we're like some of you in the same boat that our plan changes March 1. So we know that there'll be some, again, that 3-month period, front end or back end, that we'll need to take into account. But when we know that in advance, we can kind of manage that to the benefit of, the employees, and also be able to work with Sam in terms of how we may want to structure that. You may want to give the employees a little something extra because you're going to save so much that it makes sense to switch early. So maybe there's something you work out with them.
And
There's
so
some
Mark
options.
yeah, great comment, Laura. Mark has answered your question, Kim, about Medicare. Thank you, Mark. The employer-sponsored plan is primary, Medicare is secondary, but the employee can opt out of the employer-sponsored plan during Medicare annual open enrollment. And Mark is saying the employer can't provide incentives for the employee to opt out. And what he's really saying is oftentimes Medicare eligible employees can be high risk, and for that reason drive up your risk tier. And so you cannot force them off of the group health plan, right? They still have access to it if they're enrolled or employed. Excuse me. Thank you, Mark.
Thank you.
Yep.
And we will send this the slides out to everyone, along with, again, a link to the census. We also were doing a short survey to ask questions like, when does your plan change, in terms of date, and maybe what kind of plan you currently have, to the extent that you can share that information, because that will all kind of feed into, again, what, Marsh is able to work with Blue Cross to put together.
Yep. So phone a friend, tell somebody about the program, raise awareness. Everything helps. And thank you all. We appreciate your time.